What's up, rookies? Welcome to another snippet on What Pharmacists Do. Today, I'm so happy to be joined by Dr. William Amarquaye. He is going to talk to us today about what pharmacists do in a clinical inpatient setting. But I also want him to talk about some of his writing gigs and his a YouTube channel that he hosts that I found very interesting. So glad to have you on, Dr. Amarquaye. How are you doing today?
I'm doing really great. Thank you for reaching out and having me on. Really a big fan of what you do and the education that you do for pharmacists. Yeah.
Thank you, thank you. And I'm so happy that you're here to contribute to that because we want to spread the word about the integral part that pharmacists play in our healthcare system and hope to inspire people out there who are thinking about becoming a pharmacist, that they're really getting into something pretty cool. So I would like to start by having you tell us a little bit about yourself. Why did you decide to become a pharmacist?
Yeah, it's a great question. To be honest, I didn't really know what I wanted to do. I know I wanted to do something in the health field,
Okay.
but I didn't really know like what exactly I wanted to do. My dad was a pharmacist, so he worked for CVS, and he's retired now. But I really, growing up, he loved watching him and watching how much he took care of the community that he took care of, and how much his patients, loved him. And even when, he had to move different stores, patients would sign petitions to have him stay because of, the impact that,
Wow.
a community pharmacist can have for him, for a patient. So that really inspired me and kind of tipped the hat, for me to go into pharmacy.
Okay.
And so yeah, it was really inspiring watching my dad growing up
Got
and
you.
and
Got you.
be in the health field. Yeah.
Okay. Okay. So your dad kind of lit that fire up in you. And then
Mhm.
where do you decide to go to pharmacy school? Where do you get admitted? And
Yeah.
how does
So
that get you to where you're working today?
yeah, so I was living in South Florida, so I was living kind of in the Lake Worth, Boynton Beach
Okay.
area.
Okay.
So I got it accepted for undergrad at University of South Florida in Tampa.
Mm-hmm.
So I did my 4 years of undergrad there, and I got
Okay.
my bachelor's in biomedical science. And
Okay.
then I decided to apply to a lot of different places. So I applied to Nova, I applied to USF,
Okay.
and I got into a few of those places, but I chose the best for me. That would be, the most economical and stuff like
Got
that.
you.
So
Okay. Okay.
I chose University of South Florida.
Okay.
So that's where I went to school, graduated in 2017.
Okay.
So,
1 year after me.
oh, okay.
Yeah. Yeah. Yeah.
So
Sorry.
yeah, yeah, University of South Florida was there. It was a really great school. I loved the dean, and I just loved his philosophy when it comes to pharmacists and them being more integrated into the healthcare team.
Mm-hmm.
And
Mm-hmm.
I really love that philosophy. So that's kind of another reason why
Mm-hmm.
I chose USF as well.
Okay. Okay. So graduating from pharmacy school, were you already set on what path of pharmacy you were gonna go towards?
Um, Not really. When I first got into pharmacy school, my dad did retail, so I was like, I'm just gonna go to pharmacy school and graduate
And
and
be
get
like
into
that.
retail.
Uh-huh.
Um, but as I was doing my rotations and I was doing, some other things, I was
Mhm.
exposed to, different aspects of pharmacy,
Right,
especially in the hospital. And I was like,
right, right.
wow, pharmacists can do a lot of different things
Yeah,
besides, just, being in retail.
yeah, yeah, yeah.
So it was kind of, but by the time I kind of realized that, it was kind of too late for me to, get into residency and do the
Mm,
letters of recommendation and all that
okay,
stuff. So I
okay.
didn't do
Yeah.
any formal residency after school.
Mm-hmm.
So I was just on the job hunt pretty much after I
Mm-hmm.
graduated in
Mm-hmm.
2017.
Mm-hmm.
So well, after I graduated, it was definitely, which we'll talk about later, a battle for me to even get licensed because we had to take our boards, and that was a whole
Yeah,
nother whole
yeah,
nother story.
yeah,
But my
yeah.
first job after pharmacy school was in a specialty pharmacy. So I was
Okay.
pretty much working in the specialty division at Walgreens. So
Oh, yeah,
I was
yeah,
in
yeah, yeah.
Orlando.
Mm-hmm,
So I really liked that job. It was a contract position, so
okay.
they reached out to me, and it was a
Mm-hmm,
contract, so it wasn't like
mm-hmm,
a
mm-hmm.
long-term full-time position.
Got
But
you. Got you.
I was there for about 8 or 9 months, and I really enjoyed it. I love specialty. I thought I was going to get into specialty, but
Okay.
they didn't renew our contracts afterwards, so
Mm-hmm.
I had to go back on the grind and find
Yeah.
a job.
Go
So
back on the ground. Yeah.
literally I was driving store to store, going in and asking people if they were hiring. Um,
Amazing.
so
Amazing.
it was yeah, it was a pretty rough time because yeah.
Yeah. We're going to talk about your role, your current role in a minute, which is inpatient, hospital, clinical based.
Mhm,
But I like that you brought the fact that although you didn't do a residency, um, you didn't have to do a residency to
mhm,
pursue your interest. And I'm bringing this
right.
up because we just had the residency match with the SHP. Some people have
Mhm,
matched, which I'm really proud and happy for them,
yeah,
but others have not. And I think
right.
it's a good example to show people that there's more than one way to get to where you want to be. You know, you have an interest, you get your contract, you apply and then you get what you
Mhm,
get. And then from what you
right.
get, as long as you develop that interest and
Mhm,
you realize what you want, and you just like you said,
mhm,
like how you said, keep going back on the grind, and
yeah.
eventually you'll get that you'll get the job that that you're really passionate about. Some people it takes years to really figure out what you're interested
Mhm,
in, but I
mhm,
personally think it's okay.
yeah.
So now tell us about where you are working currently and what you do. What does a pharmacist do at your setting?
Yeah, so currently I work in the inpatient hospital. So my current job, I work in Tampa,
Okay.
in the hospital. I still work PRN at my old hospital too.
Okay.
So this new hospital that I work in is it's like over 1,000 beds.
Mm,
We do trauma, and it's a lot of different things at my new hospital. So it was kind of a transition from my old
it's a
hospital.
huge
Um,
hospital.
yeah, yeah, it's a huge hospital, and it was definitely a transition because I didn't really deal with trauma and stuff like that at my last hospital. So
Okay. Mhm.
my main role is basically a decentralized, what they call decentralized clinical pharmacist. So you
Okay.
have centralized pharmacists that work like in the main pharmacy and do
Mhm.
kind of the operational stuff, and then you have the decentralized pharmacists
Yeah.
that work on the floors. So
Yeah.
my main role is I'm a decentralized pharmacist, and my I kind of work. So I got hired for evening shift, and I work overnight as well.
Okay.
So if they need any coverage, then I hop in and do overnight. So
Okay. Okay.
during my evening shift, my main roles are taking in consults. So we have many different consults that we do.
Mhm.
Some of the consults include, vancomycin. So, if it is once a physician assesses a patient and thinks that they need to be on vancomycin, then we get
Yeah.
consulted to dose it.
Mm-hmm.
Another thing is warfarin. So, for
Mm-hmm.
example, if a patient, needs anticoagulation, then we,
Yeah.
deal with the warfarin management.
Mm-hmm.
Just a whole bunch of different things, renal dosing.
Okay.
If a physician needs help with renal dosing, IV to PO,
Yeah.
switching a patient. So,
Yeah.
those are the main, some of the
Got
main
you.
consults.
Mm-hmm.
Another big thing with my role is order verification.
Yeah.
So we get a lot of orders that come in, and we have to make sure that the orders are correct. So as pharmacists, we have to make sure that it's for the correct indication. It's the right dose.
Mm-hmm.
Making sure there's not duplicate therapy.
Yep. Yep.
So just a bunch of different things that we're looking at, and it's
Mm-hmm.
another big thing that was a transition to is that as pharmacists, we respond to all the codes. So
Mm-hmm.
anytime there's a code blue, if you're the code blue pharmacist for that day, we
Yeah.
have like a code box. So
Yes.
in our code box, we have our intubation meds. So we have
Mhm.
meds, for intubation like etomidate and
Yeah.
acetylcholine. And
Yeah.
then we have, some other meds in there, ketamine, Versed. So we kind of carry around our code box, and then whenever there's a code, we have to attend the codes.
Yeah.
So it's a really, great experience being integrated, in the, in the healthcare team, and as pharmacists. So that's some of my day-to-day stuff that I do, the inpatient side.
Really cool stuff. And as a student, I don't know about you, I didn't know pharmacists could do all of that. It took, getting into rotations to really realize
Right.
that it was possible. I mean, we did therapeutic dose drug monitoring, but vancomycin and warfarin, INRs, but in school, we were just focusing on the theory and passing the exams, and then putting it into practice never really clicked until you actually get to do that on and responding to codes. Those are pretty intense, fast-paced situations that
and that's the thing they don't really teach you in pharmacy school.
no.
In the inpatient side, you have to deal with a lot of death, and that's something they don't really teach you in pharmacy school.
Yeah,
because when you're attending codes, you see a lot of that, and it can play with your psyche a lot, especially when the family comes in and then they're devastated. So that's something that as pharmacists we also have to deal with as well. How to navigate that.
Yeah, and if we don't talk about it in school, I think doing this and letting people know that it's possible, kind of, I think it's our purpose with doing these videos, so we can let aspiring pharmacists know that these are things that they can be dealing with. So do you, you mentioned being decentralized. Are you hopping from one unit to the other, or currently are you assigned to like a specific unit like med surg or intensive care? How does it work for you?
So for my particular role, I kind of float around. So some pharmacists, they're specialized. So for example, we have ICU pharmacists. So they're just, for the ICU floor. We have pediatric pharmacists who just do pediatric floors. But for me during the evening, they kind of float me around. So med surg, ICU. And then for the overnight shift, that my role is kind of different for overnight. For overnight, I kind of play backup for the ER pharmacist. So I kind of sit next to the ER pharmacist in our ER satellite that we have in our hospital. So taking care of ER order verification, sometimes the consults that come in overnight. And then, if, for example, there's a bunch of trauma codes and, they need backup, sometimes I go help in the trauma. So seeing trauma is pretty crazy, especially overnight. Overnight, you see some of the craziest stuff.
I personally don't think I can deal with that. I personally don't think. And again, you mentioned a pediatric pharmacist and intensive care unit pharmacists. Many of these pharmacists have done a first-year residency and a second-year residency, but you and anyone else having not done a residency, it doesn't preclude you from doing any of those roles, right? I think it would just necessitate, it would just need you showing an interest and expressing that interest and probably getting trained. It may take a year or two. But if that's something that you're interested in, I just want to throw that out there that you can always express interest in specializing without having done a residency.
That's so important. Because I didn't do a residency, and a lot of people don't realize that, a lot of positions in the hospital, like if you just want to be like a staff, pharmacist, you don't really need a residency for that. They'll be able to, like when I first got in hospital, they trained me for a few months, just understanding the hospital protocol. And then, I was able to get integrated into the hospital.
I specifically, I also, as a student, even as I worked as a pharmacy technician for Walgreens for 13 years. And even as a pharmacy intern, I was working at Walgreens. So my mind was set in retail, for retail when I graduated. So I did a community practice residency because I wanted to do play more clinical roles, but in the outpatient setting. I mean, with Walgreens, maybe infusion. They do have some of the specialty programs. So my community practice residency was intended to have more specialized roles in a community setting. But
Yeah.
when I graduated, my first job, when you graduate, you just want to get a job and get the bills paid.
Yeah, right.
It was in the hospital, and I went with it, and I'm loving every bit of it now. So just like you in an inpatient clinical kind of setting. So now we're done. Kind of, we can talk forever about what you do in the hospital, but you also have to do other really cool things that you do on the side that have to do with writing articles for a journal that you're going to talk about, and also you have a YouTube channel where you do share your pharmacy journey. And I would like I don't want to end this without you kind of touching on that. Can you tell us a little bit about why you're writing, why you did YouTube channel, and how can people get connected, particularly with your YouTube channel, because you have some awesome stuff on there.
Yeah. The reason why I started my YouTube channel is basically because I'm very passionate about, pharmacy education, and passionate about like educating about what our profession does. Because I feel like the general public just sees us as that person, behind the counter discounting pills. And I want to, do away with that perception of pharmacists. I want people, when they think of pharmacists, they think of that, integral, healthcare member, that variety of different settings,
Before you continue, I want to, the one single reason I started doing this was during the COVID pandemic. You familiar with Costco, right? Costco,
yes.
During the pandemic, they were having all these perks for healthcare providers being healthcare heroes, and there was a long line because everyone was buying toilet paper and whatnot, and healthcare providers were allowed to not to skip the line. And I go to Costco with my pharmacist badge, and I want to skip the line, and they're telling me I'm not a healthcare provider.
Wow.
And I was like, what the hell are you talking about? So, and then there were all these bills coming up about, debt forgiveness for healthcare heroes, and
pharmacists are not included.
Never missed it. And I was like, we are healthcare providers too. And
Exactly.
Like, okay, this needs to stop. Anyway, so, and it sounds like it was kind of the same reason for you, educating the public about pharmacists are healthcare providers, right? Yeah.
It's been a big battle, especially we're not even considered, providers. And we're still trying to fight that battle. But with my YouTube channel, I'm really passionate about pain management. That's ultimately what I want to get into. I want to be like a pain management pharmacist. So kind of the education and the writing I do is centered around pain management.
Okay.
So especially with my YouTube channel, I have many different topics that I talk about. Like with, COVID, I talked about some stuff with COVID, and I talk about different pain conditions, and I talk about some of the stuff I did during pharmacy school and the journey that, brought me into being a pharmacist, and the failures that I had to overcome. And, there was one video I think that had my highest hit was about the MPJE that we had.
That's the one I wanted to talk about. That's the one I watched, and I was like, wow, it takes courage to be this vulnerable, but it really takes passion to help others also to share. So yes, tell us about, and given that many students are going to be taking the board exams, because in that video you explain the different board exams that we have to take, and what each of them entails, and so many of our colleagues are going to be taking board exams, and share us what that video was about, and what advice do you have for anyone who finds themselves in that same situation?
Yeah, so as pharmacists, we have to take board exams before, we can be licensed to practice. So we have to take what is called the NAPLEX, which is kind of the pharmacotherapy portion. And then we have to take the law exam, which is different for every state, which is called the MPJE. So I live in Florida, so I had to take the MPJE. The NAPLEX, I was able to do fine on the first try. The MPJE, for some reason, I just was not able to pass it. And we need a 75 to pass. And I was just getting 73, 72s. And that was the worst part about it, is because
We're
I was
so
missing it
close.
by, like, I was so close.
Yeah.
And you need 5 tries for each state. And I had taken it 4 times, and I was on my last try. And to be honest, at that point, I was working, as a, front desk at a hotel, because I had to pay my bills. And I just didn't know what I was going to do. I was like, if I don't pass this, then I don't, what is my plan
Yeah.
B?
Yeah. Yeah.
So I took it for the 5th time, and I got a 76.
Still very close
So I
on
was
the
just like,
other end, but still very close.
yeah. And I remember that day so vividly, because I was at my job, and I just went out, started crying, called my family members. So it was a very, satisfying moment. But the things that I did to overcome that moment is pretty much just hunkered down, and I pretty much just printed out. I went to the law website for Florida, just printed out all the laws, and I just read through all of them. And I just, over and over again, because the law test is not something that as pharmacists we intuitively, like, it's the questions and stuff like that. So, I had the slides from my law professor. I made sure I had that. And then I made sure I just went to the actual website, and I just was like, okay, let me just print out all these different statutes and all these different laws, and let me just read through them over and over and over again.
Yeah.
And, I was able to, pass it on the last try. So it was very, yeah, it was hard. It was tough.
I can't imagine.
After the 3rd and 4th try, I just wanted to give up. I was like, I'm not doing pharmacy
Give
anymore.
up on 4 years of pharmacy school and a
Yeah.
bachelor's degree, no way. And no. But would you say that the other times, the second and third, that you put in as much effort? What was different? What do you think?
Yeah, I was just trying to make sure I was doing the right thing each and every time. I was, I mean, after the 3rd and 4th try, I'm like, man, what am I doing wrong? Like, I'm reading the law material.
Yeah.
And it's just that I guess I couldn't put 2 and 2 together. It was just, and I was missing it by a few points. So it's not like I was doing terrible.
So you were doing okay.
Yeah. So it's just a few questions here and there, I guess I was missing. But, to pass it on the last try with a 76, that just was, you can't write a story like that.
Yeah, man, my mother, because I'm from Cameroon, and I know my grandparents would have been trying to find out what something mystical must be going on. I mean, this is because we're missing it by this close and working so hard for it. But the important lesson here is that with failure, it gets hard, it gets scary, but you have, as long as you're passionate about it to begin with, starting from, dad up to that point. And then you just have to keep putting.
And having people in your corner too. Like, there's many times that there's many times that I wanted to give up, but my family, my wife and my dad just being there, and it's like, no, you can't give up. You worked hard for this, So having people in your corner is really important.
Keep trying, of course, but then you're absolutely right. Having a support system to hold you, to help hold you together throughout the process is absolutely important. So you're a pharmacist now.
Yeah.
For a few years already. Praise the Lord. So what do you like most about being a pharmacist? What's your favorite thing?
Yeah, what I like most is kind of the different things that I've been able to do. Like what I was saying before, like, with my writing gig, I currently write for Practical Pain Management Journal. So I write, it's like a chronic pain series that I write for them. So it's kind of stuff that I've experienced, and to kind of make it into like a scenario where, a patient comes in, and as a pharmacist, what do we do to counsel that patient? So I kind of write patient scenarios for that journal.
Yeah.
So I love being able to use my knowledge as a pharmacist to do certain things like that. And I also just love interacting with physicians and nurses, respiratory
Yeah.
therapists. Like that's what I love about the
Yeah.
hospital setting, because you're right there at the bedside, like interacting with, many different other health professionals, and they're, seeing your how valuable you are to the team. So
Yeah.
it's really great.
That's
Yeah.
one thing I wish that retail pharmacists had,
Mm.
access to patients' charts and,
Right, right,
access to providers to clarify things
right.
and make it easier for the patients and get them
Mm.
their patients, sooner
Right.
than later. But that's what you like most is also what I like most. It's just
Mm.
the versatility of the profession and the wide array
Mm.
of practice settings you're able to work in and
Right.
to play for patients, for
Mm.
companies, for journals, for
Mm.
pharmaceutical companies,
Mm.
for your own startup. What is the pain management job going to look for you? Like, what's your vision?
Yeah, so that's a great question. I want to be in the inpatient side. So
Okay.
I don't know if you ever heard of they're starting to be like opioid stewardship programs.
I have
So it's
heard.
kind of like
Yes,
a
yes.
kind of
Okay.
piggybacking off of antimicrobial stewardship. So
Okay.
basically your role as a pharmacist is to make sure you have safe and effective use of opioids in the hospital,
Okay.
managing, multimodal,
Got it.
therapies,
Got
managing PCAs and stuff like that. And
it.
so being
Yeah.
part of a team like that. So
Okay.
that's my dream. And
Yeah.
not doing a residency is going to be harder for me to get there, but there's a lot of things as pharmacists, which is also another thing about it. Another advice I'll give is that, there's a lot of things as pharmacists that if you don't have residency, you can do. For example, like ASHP offers a pain management certificate that I'm gonna do.
Yes, the certificates. We
So
have a whole other episode.
there's many things that you can get into as pharmacists that you can educate yourself,
Yeah.
to be
To
able
set
to be
yourself up.
competent.
Mm-hmm.
Yeah, to be able to do that position.
Yeah,
So yeah.
absolutely. Yeah, as soon as you said opioid stewardship,
Mm,
I kind of saw that vision. Yeah.
mm,
Um, so we're kind of drawing to the end here, and you've gone through so much, and you have made it through so much.
mm,
What advice do you have for prospective pharmacist students, anyone who
mm,
aspires to be a pharmacist, and then newly graduated pharmacists on how to make it through
mm.
mm,
Yeah.
pharmacy and be the best pharmacist that they can be?
Don't I would say is don't limit yourself, right? There's many times where I was applying and I would see the requirements for that job, and it's like, oh, I don't have those requirements, but I
I
still
have
would
heard
apply.
that. Yeah.
I would still apply for those jobs, and you know what would happen? I would get a call back, and they were like, "Oh, don't worry about those requirements. I'll train you." You know,
Yeah.
so don't let those things limit you. Just apply anyways,
Mm-hmm.
and
Mm-hmm.
which is another big
That's
thing.
good.
Also, networking. A lot of the stuff I've been able to do, publishing papers, the writing gig I have, is because of social media, and it's because
Yeah.
of being able to network with
Yeah.
other, people, other pharmacists and other clinicians. So
Mm-hmm.
social media, it can be a bad thing, but it can also
Yeah.
be a good thing,
Yeah.
you know.
LinkedIn is not bad at all.
Yeah, yeah.
Yeah. Okay.
And the one social media site I think that's helped me with all this stuff is Twitter. Twitter can really get your content and stuff out there.
Really?
So that yeah,
Cool.
that's kind of how I've been able to link up with a lot of people, and yeah, so I would say networking and not limiting yourself is kind of the big things. Yeah.
Not limiting yourself. You're the first person that said that ever. Not limiting yourself, because I have
Mm-hmm.
done that in my early years, looking at a
Mm-hmm.
job and being like, that's not for me. That's
Right.
for the PGY1 or the PGY2. But
Right.
then you apply and they tell you exactly why would you
Yeah.
put it on there if you're gonna
Right.
anyway. That is such a good one. Do not limit yourself, because
Mm-hmm.
you were trained as a pharmacist. The whole pharmacy curriculum
Mm-hmm.
taught you the basics, and all you
Right.
have to do is be able to find a company that you fit with
Right.
personality wise, and then they can train you.
And a lot of companies out there, they rather take the person who's passionate and
Yes.
can work
Yes.
work as a team player and doesn't have versus someone who does have a residency and it's not, is not that. So,
Yeah.
just from my experience.
Yeah. And the networking, oh my gosh, you cannot not network. It's like, you have
Because
to.
pharmacy is a small world. You have to network. Yeah.
such a small world. And then social media, which was part of networking, and Twitter. The thing that makes me shy away from Twitter is that I feel, tell me if I'm wrong, that Twitter is very professional, and I think like I just like to have fun with my stuff. I don't feel like.
So I think Twitter, out of all the social media, I think Twitter is kind of, well, in my opinion, the least professional. I'm the least, I'm the least professional on Twitter.
Okay, I'm definitely gonna check it out. I do have an account, but I never really. But I'm gonna start checking that out. Such great information and advice and inspiration that you have given us. Thank you so much. Thank you for coming on.
Thank you.
Sharing your journey and your experiences with us. And when you do become that pain management pharmacist, we'll have you on to talk about what a pain pharmacist management does.
That'd be great.
Didn't say that right. A pain pharmacist management. A pain management pharmacist. Thank you, William. Thank you so much for coming on. And on to the next one, guys. Everyone else, if you really like this video, don't forget to subscribe and like and comment and share with friends and family. And until the next video, stay blessed. God bless you. I love you. Bye-bye.